Hey dear friends, it's Misty. I'm a sales channel and we have a very friendly community here. Feel free to subscribe and hit the little bell that says notify me. I work mainly on the weekends with live sales and you can make some new friends. It's a fun, easy way to shop and a great way to spend Friday, Saturday, and Sundays, usually at night. I'd love to have you. And if you're not new, welcome back. Thanks for listening. This is going to be kind of short. So this is more about personal matters than work matters. And you all know I had an appointment with the gynecologist today. I think that's how you would say it. And we got a plan to remove the couple of spots that I have in my bottom private area. And I will have a outpatient surgery on Wednesday, June 29th. Said it should take about an hour. And I couldn't be frozen or use a cream because of the size. And I want to talk about that in a minute. The size that the spots had gotten to. And they've been biopsied and they were precancerous. However, they're a high grade 3. And what that means is what separates what I have right now from actually being cancer is how far it has grown into my healthy skin. And when they remove the spots, they'll biopsy them further and biopsy the healthy skin they remove around them, just to make sure that it's contained and everything was gotten, you know. She asked me if I worked, and I was like, yes, from home. She said, you're going to be very uncomfortable. And I was like, for about how long would you guess? She said, a week at least, and probably, you know, up to 2 weeks at least. And for me, one of the reasons it's going to be so uncomfortable is one of the spots is on my panty line. Exactly on it. And so much, it's so bothersome. I've even been without my, I hate to say panties, bloomers, underwear, whatever you want to call it. My hidden linens. That's not normal, is it? My hidden linens. So she suggested going commando or wearing like little boy shorts, or like my husband said, even wear his boxer briefs, you know, boxer underwears, whatever. But to sit, I'll have to kind of lay back, and just to walk, you know, the rubbing, the friction that will occur. And I've got to be very careful to keep it dry and clean. And I think they're going to give me some like numbing cream to put on after. And she said, you'll be very surprised at the size of the incisions, because she had to explain the way they cut it in order to get healthy skin around it. And she said it's going to probably be larger than what you'd expect. They don't just take the tiny spot. So that's a in-depth kind of update for what I'll be having soon. I'll be glad to get it over with. And what I was going to tell you about the size they've gotten to. I had, and I share this in case you're like me, an anxiety about going to the gynecologist. I hope this isn't TMI. I hope it's okay I'm talking about it. I'm doing it in a very respectful, clean, posh way, as well as I can. It started out like a little skin tag, and that's what I thought it was, because I've had a few skin tags, which I was so happy with, around in my neck and my necklace. You see that one right there? Though you can see my scars here, but it was kind of like that, and I had them removed. I thought it was like that, and just down there in the private area. But the growth that occurred, I let that go for about a year, and I shouldn't have. And toward 9-10 months in, I kept saying to hubby, I've got to let somebody know about this. And what ended up happening, I ended up going to my normal yearly physical, And my primary care doctor is a lady. I prefer lady doctors, you know, just to make me feel more comfortable. And I just said, she said she's going to do a pap smear. And I was like, well, I didn't know you was going to do that, but since you'll be down there, I want to tell you about this spot. It was mainly one, you know, that I noticed getting so big. And it's probably about the size of my fingernail, my pinky nail, which is quite large for like a spot or skin tag, especially to be in your panty line. And I said, since you're going to be down there, I'm going to go ahead and tell you about it because you're going to see it. And as soon as she saw it, she's like, no, that's not normal. And that's what got the referral, the ball rolling to the oncology, because of where it was, the size of it. A regular dermatologist, it wouldn't be as well if they had done it. So I learned a lesson from this, to not let my anxiety or my not liking those kind of checks, or not liking to expose that area, to keep me from getting the attention and good care that I need from my body. You know, I'll finish with this. A big part of my channel, I also share, in a lot of my videos I upload, is about this journey I'm on to learn how to love myself. But it all started with a desire I had, a genuine, deep desire that I've had for at least 3 or 4 years now, while I was working on not judging others, you know, because it just kind of naturally came to me as I was seeking to grow, become a more mature, kind of wise, insightful person. It came to me that I was judging other people, which is kind of a natural thing, you know, from the outward, not knowing much about them, just passing judgments on, you know, different people, whether it be their religious beliefs, their political beliefs, which not really, but just different things, you know, how naturally you can do that. And so the best I could do is just to be aware when I was doing it and ask for help and for me, it's, you know, from the divine, God, to help me not judge others. And as I got into that, practicing that, it, you know, the desire to love others as myself came about. And about a year or two into practicing this, I realized I don't quite love myself. I don't accept myself. How can I accept other people the way they are? Just the way they are. Not how I want them to be, not how I wish them to be, nothing, but just at the level they're at, where they're at. You know, and humble myself to meet people where they are. No matter what walk of life, what issues they struggle with, anything. And I cannot truly do that unless I can do the same for myself. So, I don't know if it comes across selfish or whatever it might be, but this journey of learning how to love myself, my intentions or the motivation for it is to be able to do that into other people. And this journey is good. It's good. But I didn't realize how much I didn't take care of myself. How I always put myself last. You know? And while I might could boast or people could see in me that I'd help so many people, drop everything, run and do for people. You know, whether it was family members, strangers, whatever. I wasn't giving myself at least the same time or care or regard. And I need to do that. I want to do that. And I'm finding that as I'm working on myself, loving, accepting, being forgiving to myself, gentle with myself, flaws, and all these good things, that it's becoming more easy for me to do it for others, naturally, without trying. But the biggest one, I suppose, if I can love myself and be okay with me, Misty, who I am, then it's just like it falls into place. I can do it for others. So, but taking care of your body is, I mean, this is the container we live in while we're here on this earth. We know that, you know, it's deeper than our skin. Beauty is only, what they say, skin deep. Who we are, mind, body, and spirit, is so much more than these containers or bodies that we live in. But it's what gets us around, right? It's what opens, this mouth opens so my thoughts can come out. You know, these eyes help me to see others and behold such beauty in the world. And, you know, ugliness at times, but I have to take care of my body. So I just thought I would share a little bit about this and to encourage anybody else that might listen to do the same for yourself. You know, you've probably, if you're like me, you've spent years looking after everybody else, taking care of the children, which is all good and necessary. But let's not forget about ourselves. I've been putting off getting glasses for at least 2 years now. You know, different things like that. And, yeah. So I just wanted to say, you know, if you're watching me or following my channel because of my journey this way, thank you for doing that. And I hope something I share could help. And if you have any feedback or experiences, feel free to share them here with me. And then too, also this is my work, this channel, which is in sales, purses, clothing, jewelry, you name it. And I enjoy it. And it's really just like a medium for me to meet people, to have the opportunity to love others as myself. You got to have people in order to do that. And this job just brings about so many people from different walks of life, different ethnicities, different beliefs, everything. And it's a great practice for me to do this, to love others. So, yeah, I just wanted to share that. Thank you so much for your prayers for me and keeping me in your thoughts, your emails for checking on me. You know, I have this in a couple weeks, pretty much exactly. Who knows what kind of condition and shape I may have to sit on a donut. I may have to not sit for long periods of time. I don't know. But, you know, I've got to continue to work and have my sales. So I'll do the best I can. In the meantime, I'm just taking a break from invoicing and shipping. I'm kind of backlogged because of my mom being here. She left yesterday. She got home safe because of vacation last week. And quite a bit of orders. But if you haven't received your invoice yet, I'm working on it. And I'll be working all the rest of the week to get packages out. And I've got to check tomorrow. I will have to leave and go sourcing. And when I was going to stop by my main place I get clothing on my way back from my appointment today. But as I went by, there was at least 10 fire trucks in the parking lot of my little thrift store. And right next to it is the funeral home. I didn't see no smoke. I don't know what was going on. So I'm going to probably go tomorrow and check on that. And also, either Friday or this coming Monday, I've got to take hubby because he can't drive right now because of his vision's messed up again because of the inflammation in the bad eye. I've got to take him to his specialty doctor, which is about an hour away. So all these things are taking time away from my job. But know that you're on the forefront of my mind to care for, send your packages out. And good Lord willing and the creek don't rise, I'll be back this weekend with new clothing, jewelry, and items like that. So if you don't mind, give me the thumbs up and leave me a comment. Thank you so much for watching and being part of this channel. I appreciate y'all and I love ya. Mwah.